Opioid use and overdose is a widespread issue that grows more urgent every day. You've likely seen a piece on your local news or a headline in the paper that showed the dimensions and consequences of the issue. Opioids are used in the treatment of pain, but are often sold illicitly and abused for their euphoric effects. An overdose occurs when larger quantities than physically tolerable are taken, resulting in central nervous system and respiratory depression. Tackling an issue currently recognized as a national crisis, we wanted to break it down and see how it functions and affects individual neighborhoods. So we chose to focus on opioid use on Massachusetts Avenue, an area right by our school that has gained recognition and consequently the label as Methadone Mile. Opioid addiction is characterized by a powerful, compulsive urge to use opioid drugs even when they are no longer required medically. Substance use refers to the use of drugs or alcohol and includes substances such as cigarettes, illegal drugs, prescription drugs, inhalants, and solvents. Substance abuse refers to the harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs, that leads to a dependence syndrome. Looking at the issue from a multi-causal perspective, we identified 20% of the issue being due to a lack of intervention, for example, affordable and accessible resources for those already suffering on behalf of the issue. Additionally, there's 20% of education as a factor, for example, increased awareness on the action of drugs and their consequences. Another 20% could be related to homelessness. Drug use often occurs with individuals experiencing homelessness as a survival tactic, such as to increase alertness overnight if they're taking shelter somewhere where they are not welcome. Another 20% could be attributed to big pharma. Opioids such as codeine, oxycodone, and fentanyl have been overprescribed in order to increase pharmaceutical revenue. Another 10% could be a result of mental health, as mental disorders are often comorbid with substance abuse disorders. The last 10% could be attributed to uninformed drug sales. This is when a substance is laced or cut with something significantly more dangerous to increase profitability than what it is advertised to actually be. Opioid addiction has already been recognized as a national issue, or rather, a crisis. In the late 1990s, there was a sharp increase in medical prescriptions for opioids, as doctors were reassured by pharmaceutical companies that prescription painkillers were not addictive. This was followed by an increase in non-medical opioid use, reaching a peak of 2.7 million new users in 2002. In 2012, the annual number of non-medical users declined to about 1.8 million. However, the mortality rate of opioid-related overdoses increased by almost fourfold. Oftentimes, those suffering from opioid addiction were once prescribed them for chronic pain. About 80% of people who use heroin first misused prescription opioids. Between 1999 and 2017, drug overdose deaths rose by nearly 40,000. While overdose mortality is the most dramatic consequence of increased opioid use, we have to keep in mind that it's not the only consequence. Additional consequences include rates of emergency room visits for non-medical opioid use, as well as neonatal abstinence syndrome, which have both increased. There are, however, measures being taken on a national level to combat this issue. According to the Journal of American Medical Association, prevention of prescription opioid misuse alone is projected to have a modest effect on lowering opioid overdose deaths in the near future, and a multi-pronged approach is needed to dramatically change the course of the epidemic. Considering the dimensions of the issue in Massachusetts, the state has been ranked one of the highest in opioid-related overdose deaths. In 2017, there was a rate of 28.2 deaths per 100,000 persons, which is twofold higher than the national rate. According to the Boston Public Health Committee, from 2011 to 2015, Boston and Massachusetts experienced similar levels of significant increases in unintentional opioid overdose mortality, an increase mainly attributed to fentanyl. Unintentional fentanyl overdoses in Boston have increased to 83 deaths in 2015, compared to having less than 10 deaths over a 3-year period of 2011 to 2013. At the intersection of Melnia-Cass Boulevard and Massachusetts Avenue lies an area that has been called the Methadone Mile. In this area are located our various drug treatment centers, halfway houses, and 2 homeless shelters, and this has become an area known for drug opioid activity, from drug deals to use, often occurring in plain sight. As illustrated in the map, Methadone Mile is where the most discarded drug needle pickup service requests are made in Boston. According to the Boston Globe, people who live in one of the shelters can make it to therapy groups, see their primary care doctors at BMC, and visit a recovery center without commuting all over the city. Although the city of Boston, in terms of fighting the opioid epidemic, attempts to prioritize treatments over arrests, according to the BPD, over 200 people within a quarter-mile of the Melnia-Cass Boulevard and Mass Ave intersection have been arrested within a 9-month period. The functioning and formation of the area, nicknamed Methadone Mile, aligns well with our multi-causal perspective we attributed to the issue, providing services that altogether create the perfect storm for drug users in the city. As for our primary area of research, Massachusetts Avenue, crime has increased 37% from January to September 2019 as compared to the same period in 2018. There was recently a strategic plan released called Melnia-Cass Mass Ave 2.0 Plan, which attempts to address the opioid epidemic locally by focusing on those 2 areas. That said, this effort has not been entirely successful. Operation Clean Sweep was entirely undertaken at the discretion of the police department, leading to a 41% increase in violent crime in the area. However, other efforts are being taken to combat the issue locally. According to Mayor Marty Walsh, $1.6 million were allocated in 2016 to tackle this issue, resulting in efforts such as the 311 recovery phone line, a homelessness task force, and the first municipal office of recovery service in the country. We hope to see successful community-based efforts continue in the future.